The coronavirus is an American catastrophe, but the president yesterday projecting optimism. Let's go down to CNN senior medical correspondent Elizabeth Cohen. And Elizabeth, for people who missed it, tell us what the president said about the vaccine timeline.
The president said that we could have a vaccine much sooner than anyone else has. Let's take a listen to his exact words yesterday.
We are rounding the curve. The vaccines are being delivered literally. It'll start next week and the week after. And it'll hit the frontline workers and seniors and doctors, nurses, a lot of people.
So starting vaccine distribution next week or the week after. Now let's take a look at reality. So let's look at a calendar. The FDA is going to have a meeting with their advisors on December 10th about Pfizer's vaccine. That's the first vaccine out of the gate. And the head of FDA's vaccine agency, or the department within the agency, has said that they will then need to review and do analysis for days or even weeks. So that does not get us to vaccine distribution next week or the week after. It is going to take longer than he is saying. What Dr. Anthony Fauci at the NIH has been saying for some time now is he expects the first Americans to get vaccinated in the latter part of December. And Brooke, as we've discussed, they will start with frontline healthcare workers, the elderly, and other high-risk groups. Brooke?
What about specifically the AstraZeneca vaccine? I know the World Health Organization is weighing in on that vaccine and some of the reporting issues. What are they saying?
Right. There are some issues with AstraZeneca's data and some issues with their transparency. So let's sort of give a list of the three big ones. One, there was a dosing error. They gave a couple of thousand people the wrong dose. And so that means that when you're starting to look at that data, sort of what do you do with that data? And also, what other mistakes might have been made? Because it's a huge error to give thousands of people the wrong dose. Also, there's some missing data in this press release that was put out. They said it was on average 70% effective, but they didn't say how they came to that number. Moderna and Pfizer, when they put out their press releases, they did. So obviously the WHO wants to see real data, not just a press release. Also, in the press release, AstraZeneca didn't give any details about two participants who were in the clinical trials, got the vaccine, and developed neurological issues. They didn't say what happened to them. Why is AstraZeneca so sure that the vaccine wasn't the cause of this? Why should regulators be so sure? Why should the FDA be so sure? Why should the WHO be so sure? So the WHO for sure will be asking questions about that as well.